Welcome back to Technique Tuesday. My name is Nick at Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. Today we're talking about adhesive capsulitis, and I'm going to show you how you can know if you have it and 2 exercises you can do to help you maintain or improve your range of motion. Alright, so how do you know if you have adhesive capsulitis? Often this is a result of some kind of rotator cuff or shoulder injury that has gone on untreated, that now maybe you had pain sleeping for a while, maybe you had some pain as you were reaching or trying to dress. Now that pain's not as bad, but you're noticing that you can't raise your arm up equal to your other side. So how do you test it? Lean up against a wall, get your back flat, your head flat, raise both hands up, and if you notice that one is significantly further away from the wall than the other, then it's probably stiff and limited from adhesive capsulitis. The other way is reach up your backside with one hand and see how far up you can go on one side versus the other side. And what you'll notice is if this is my bad shoulder, it's going to get stiff and tight as I reach back behind me. Meanwhile, my good shoulder, I'll be able to reach up mid-back, maybe even between my shoulder blades. The 2 exercises that I want to show you to do to get that shoulder moving and to improve that overhead reach. The first one is get to a wall. Walk up that wall as high as you can. Once it feels stiff, stay right there, but then scoot back with your feet, and I want you to lean your chest down towards the wall, keeping the elbow as straight as possible and your head and neck upright. And you're going to stay here 30 seconds, 3 to 5 times. You can do this multiple times a day. What I also like is to get a few different angles on it, so as you kind of load the wall, you can go straight in. You can also go towards or into that shoulder as your hand is fixed on the wall, and you can also come away from that side a little bit just to change the angle of where that stretch is applied to that capsule. The other one I like to do is put your hands behind your back, kind of like at the small of your back or just along where your belt would wrap around your waist, and then sit up against or lean up against the wall, and then I want you to go as flat as you can with your elbows on the wall and your head and shoulders all touching the wall. And if you're restricted and going behind your back, you're going to feel like maybe you can't lay flat yet. Maybe you're off the wall a bit because this shoulder's too stiff. So you're going to work on relaxing that shoulder, working that motion in so you can sink in and lay flat on that wall. One little tip that we like to do is where you push your elbow into the wall. I'm pushing that elbow into the wall where it's not moving. Hold 3 to 5 seconds, relax, and try and go a little bit further into that stretch. Easy push into the wall, 3 to 5 seconds, and then relax and let that sink in further. I hope those 2 exercises help you. I hope they're easy and clear for you. Biggest thing to take away, the more you move and the more you move intentionally, the better. The earlier you get treatment for this, the better your outcomes, so that those restrictions in your motion don't stay permanent. Hope it helps. Have a great day.